Nisha Jose, Clinical Team Leader for Telehealth, Health Technology and Access Services in Liverpool. The virtual ward model supports patients with pneumonia, COPD and heart failure. We monitor patients very closely for 14 days. The patients can submit readings to us via our Docobo platform. We are trying to replicate the same model as a ward setting, and also we have incorporated a News2 scoring system to optimize the patient safety. So the patients will have a consultant assigned to them, and also they will have an assigned clinician each day.
My name's Colette and I was recently diagnosed with heart failure in January of this year, January 22. But a lot of your time is taken up by hospital visits, which in turn impacts on family life. But in March of this year, I was asked if I'd like to take part in a new concept of the virtual ward. Of a morning, I generally take the readings, and I try and do it so it's the same time every day, just for a bit of stability really. I take my blood pressure, the heart rate, temperature, and I take the weight. Very simplistic to do, really easy to do, and then it's inputted onto the smartphone. So the smartphone actually asks you various questions, blood pressure, and gives you the details of how to actually just input. So it's literally the press of a button. It's nothing which is difficult to do. Once that's inputted, that goes through to the nurses at Telehealth who monitor this.
After 3 days of admission to the virtual ward, her symptoms got worse. So we have escalated that to the consultant. We have sent her to the ambulatory care unit. We have arranged IV treatment for her to make sure that she is safe to stay in the community.
So it's almost a personalised system, if you like, which is done instantaneously. So it's done at the time when I need it, which for me is a big plus. I feel really safe with this because I've got basically the nurses at the end of the phone. So I feel that I've got this constant monitoring, if you like. The fact that I'm not actually in the hospital, it's just something I feel that works in tandem with the hospital.
So that is the advantage of a virtual ward. Pre-procedure or post-procedure, whatever complications you have, we will see it first. So by identifying it early, we can rectify that problem. So that prevents the hospital admission, that prevents the aftercare.
Knowing that you've got this quality time, that's the whole basis of it. Knowing that you can now do what you want to do without being time restricted.
It is the futuristic pathway that we need to go for any conditions. I would suggest any long-term conditions, if we can look after them at home, that would be the best care, provided we are delivering the service with quality and safety.
Mersey Care, NHS Foundation Trust, Telehealth, Health Technology Service.